because I think I love how our team has this great camaraderie. You know, we do this team thing. So we're going to go ahead and record this so we can use it in the future. And it froze right on a really super cute face of yours, Miss Prosper. It's a cute face. And so that way, you know, we can probably use this for future, but then we have, you know, there's another one. And then, but then we have it for, that way we can just, you know, for our future. So, okay. So what I'd like to do is, like I said, we'll go ahead and get this recorded. Maybe. You know me. You know me. There it is. Someday. Oh, and Miss Debbie. Debbie is coming in too. So, hi, Debbie. So, all right. So, well, welcome, guys. I know we've talked about this before, and I know even as far as oh my gosh, that's kind of scary. Okay. Is somebody not muted? Can you mute your phones? Is it possible? Oh, there's a puppy dog. Okay. So what I'd like to do is just go ahead and we're going to talk as a team and kind of say, okay, you know, one thing is a lot of times we have happening is we'll have a client that reaches out to us and says, hey, I'm having this issue. And it's up to us to figure out what's going on. So I think a lot of our past trainings has been more, hey, this is the calming support. This is what it does. This is who it helps. So where at the same time, you know, where I think what I'd like to do is let's discuss certain disorders or diseases or issues that we're seeing with our pet parents and their own pets. And then we can brainstorm and say, you know what, well, I know this really works, and this really works. And work on selling things as a bundle. Does that make sense? Versus just saying, hey, I have a dog with this horrible anxiety. And then, you know, there's certain things we can also be treating in the meantime. So we have to make sure that we are actually going through the pet health assessment. So we're not limiting what our sales are. Now, my question too is there anybody in this group, this might be, do you have any chance of print out? Did you go through the questions and do a printout at all of the pet health assessment?
I did not print them out, but I have two different versions. So I have a version that I use for Facebook, and then I have the version that I use for our fairs. But it really highlights on the top questions, not so much the activity questions and stuff, but it's hitting the, you know, the stuff for skin and coat and calming and all of that.
Okay. Because what I'd like to do is I'm thinking too is if we printed something and I was thinking about putting something together too, especially for the new people who is almost like a tree that says, okay, yes, the dog is urinating. Has it been to see a vet already? Does that make sense? Because so for a lot of new people aren't, you know, I don't want us to just say, oh, your pet's peeing, here's the wet away. Does that make sense? When there could be an underlying condition. It's not that we can help all these conditions. It's just that we know to say, you know what, that's something you need to talk to your vet about. But in the meantime, here's this wet away and this can help. Does that make sense? So that's some of the things that I want to kind of discuss. And I think if we discuss each issue or even talk about certain issues that you guys are seeing and how we can properly, as a pet consultant, get them in the right direction. Because there's going to be stuff out there that, there's a lot of stuff out there that we can't handle. And I think everybody needs to know that that's okay. We're not supposed to be able to handle it. We can't. Even I'm going to tell you right now, but it's our job to say, you know, you need to see that. You need to see that. Because you're going to find over and over again, as you get busier, that people are going to expect for you to be able to diagnose things for them. And, you know, if we are not able to do that kind of stuff. So we just have to be real careful. And I just don't want anything to get slipped. Like I said, simple thing like urinary tract infection that we can advise somebody to, instead of just saying, oh, here's the right away, this is what you need. Stuff like that makes it a little bit more personal, and it makes people want to come back to us more. Does that help at all? So Debbie, what is one concern? And I know you have puppies right now, but this is actually a good thing. Let's talk about puppies. let's talk about puppies, because a lot of times clients are gonna say, you know what, I have a puppy, I don't need anything. I can have 2 healthy dogs, there's nothing going on with them, whether it's a 5-year-old or a 7-year-old, right? So what I often will say to them is like, yeah, thank goodness, let's prevent those problems. And something that our pet assessment will do, so the importance of knowing what's in that pet assessment, and if you haven't played with it yet, because I know Dawn and Debbie are still pretty new, is you go right to the website, your website, and I can help you with that, not a problem. And what the pet health assessment does, which is perfect for new people, is it has your client, and you can do it right with them, is it has the client, what breed is your dog? You know, that alone can tell you, especially with puppies, like, you know, Debbie, with labs, you know, down the road, more than likely we'll have hip issues and hip arthritis and joint disorder. So that tells us right away, you know what, let's get started on that hip and joint to help, you know, prevent some of those issues in the future. Because once the joints are starting to deteriorate, there's a lot of damage that's already been done. And it's our job to help prevent that. So, you know, the multivitamin is another one that you can sell to anybody, except I do not, this might be me, and Ms. Trasper, I know you've gone through the course as well. I do be careful when you're talking about pregnant dogs, because too much calcium, because most of the time with pregnant dogs, the dog should be on a puppy food, which is going to have that higher calcium in it. So for me, I don't want our pets on actually any pregnant dogs, to be honest. I don't recommend any of our products, especially not the dental system. So that's one I automatically say absolutely not. Is that spirulina that's in it that can, forgive me, I don't remember what it is, but it's not something that should be given to pregnant nor lactating. So dogs that are nursing. So that's another one. But just ask me. I mean, ask. We are all a team. We'll figure it out. So, but the pet assessment will help walk you through that, because it, you know, talks about the age. Does your pet, you know, have itchy skin? Do you see redness? Do you see rashes? What does the breath smell like? And because I've been in the industry so long, I kind of already know what questions to ask, but that's what it's trying to do. But for those of us that are new, that pet health assessment is crucial, absolutely crucial. And as you do it more and more and more, you will learn that you'll learn what to ask. You're gonna know. And what's pretty cool too, honestly, is the names that we have for our product, like calming support for multivitamin, is kind of self-explanatory. And I don't need to make this sound like it's more hard than it is, because it's not. It's not. I just want you guys to fully grasp the idea of being a pet consultant, because when you take it seriously, you're gonna go really far, and that's when you go really far. And it's such an amazing, oh my gosh, to be in the pet industry, you guys have fun. Wasn't it everybody's dream when they were a kid to work with pets? I'm not sure if it was mine or not, to be honest. Oh no, I want to be astronomer. You know what I'm trying to say. The astronomer, what is it? Astronomer? There, I got it. So, okay, so let's go ahead and like we were talking about, because Debbie, since I have you on right now, let's talk about the hip and joints, okay? So with the pet cup, it comes in 2 sizes, okay? It doesn't mean small dog, large dog. It just means there's more in this container. And this is by far the better deal. By far the better deal. So this is something too that is from 8 week on. I'm saying, go on.
I was just gonna say the milligrams are higher in the bigger container, so it actually is for bigger dogs than small.
Yes, I was gonna say,
If you
I
look
thought
at
it was,
Seriously?
I thought
if
they
you
were
look at
bigger.
Well,
they are.
well, this though is the serving size is 2 chewies, but the serving size with this one is only 1 chewy. But they're
Correct.
Yeah,
Does that
but
make
look at the main ingredient. Look at
okay.
the main ingredient. Look how many grams or whatever it is.
Yeah, but it's doing 2 versus 1 is
Right.
what's happening. So if you take
Right, but
the,
if you give 2 of the large dog ones to a little dog, it's gonna be too much.
no,
Right, so you don't
yeah,
give them
you only
one.
give them one.
Right, but in 1 chew is like twice as much as in 1 chew of the other.
No, because on the large container, the serving size that they're telling you is per 2 chews. In the small one, it's per 1 chew, and it's exactly half. So if you look at the small container and you take the 262 and you come over
Yeah, but I
here, it's
just did the math
565.
on all of it.
It's just the math. So this one's actually giving it to you in 2 chews. This one's giving it to you in 1 chew. So if they do
That
this
makes sense.
one and only use 1 chew, it's what's on the back of the 1 chew.
Does that make sense? You see that?
I think she's
It's
She's frozen.
breaking out
Does
right
it say
now.
on the front? I don't have mine with me. My kid to be
That's
honest.
okay, hon, I'm
Or not?
looking.
Does it say on the
Yeah,
front?
the-
Does it say for?
It says for medium and large dogs, but it's still, the milligrams is still the same. So, does that make sense? So per 1 chew, it's still exactly the same. But I will sell this to, you know, especially, it's a better deal for them. I think it ends up being about a $10 savings. Is it 60 to 60? So it's the same milligrams, guys. And if you, it's the same. I'm sorry.
Okay, that's fine. I
It's
just
okay.
wanted verification because
And do you want me to take pictures too?
no,
So you
no, I
can
have
see
it at the office and I have
Okay,
my training
okay.
manual at the office. Yeah.
Yep. So yeah, so that's what I tell people. So the key ingredient is, you know, and to be honest, if you prefer, it does say for small dogs, it will avoid confusion to your clients if you do it this way as well. But if they do it multiples, I always try to upsell them to this one. It's just, I mean,
Yeah, it's a better deal.
for them. And
Right.
actually, right. And so like since we're talking about what is so cool about our perna canaliculus, our hip and joint is that ingredient perna canaliculus. You'll see it in some. Also, it's also green lip muscle. It's found in New Zealand, so we had to go pretty far to get it. It also has the other stuff that's important to it, like the MSM. It has the glucosamine, and let's see, what else is in it? The DMG. So there's a lot of stuff in here that's really good. The other thing too is that our products are formulated, so the meat that's in them is hydrolyzed. So that means that dogs that have meat allergies, it's perfectly safe for them to eat because the protein doesn't pass through. It's formulated differently, so it's safe for the dogs to eat. So that's something that's huge as well. I'm trying to think what else. So for example, I want to go ahead and give a good testimonial because we know testimonies sell. So like with Dawn and Debbie too, we have, I'm not sure if you guys been on the page yet, or if you remember about it, we do have the Medeka testimonial page. Those testimonies are what people want to see. They don't care about the ingredients necessarily. Sometimes you're going to find somebody that really like, well, I need to know the ingredients, which it makes sense. But most of the time, people just want to know what it is that's in, why it doesn't work. What does it work? What is it going to do for my pet? So that's one of the things that I love to share. I have 14, they're not my dogs, they're two of my clients. I have a 14-year-old lab client and a 13-year-old lab client, and both of them switched. They trusted me. They started taking the products. Woody, and Charlie's over here, but they both were taking stuff from their veterinary clinic, the supplements that the vet sells. They're chalky tablets, and they don't taste good. So not only do they have a problem, just they had to hide them and everything, but ours are good. So let me show you for those that haven't seen them yet. They smell like molasses. I think it is. I love the smell. They're very chewy and they're moist. So they're easily eaten and palatable. But both of my clients, with both of them, within 9.5, 10 days, contacted me and said, Heather, you are not going to believe this. So Woody was now walking 2 miles a day with his mom again. They no longer, and you guys know that I love the veterinary industry. I will never knock it. But they no longer are using those products. And she did with Woody, she did take these products to her veterinarian, and he was 4. Unfortunately, the veterinarian is in, now that's something else you find, he's not privately owned. He is in a, what is it called? A corporate. Like you may hear Banfield, or so it's owned, it's a franchise, it's a veterinary franchise, sold out to a franchise. So he's not able, they're not able to sell these products there, but he was very impressed. So that's our hip and joint. Anytime you think of, anybody's gonna say, oh, you know, my dog's, you know, stiff and sore. The other thing the pet health assessment is going to tell you is going to go based on the breed. So when the breed's entered, so as soon as somebody says, oh, I have a lab, or oh, I have a Rottweiler, you know, immediately you start thinking about things like joint, even if they're not in problems right now. So do you guys want to add anything to that at all? As far as hip and joint goes?
So you recommend starting puppies on it?
I do. I'd get
Okay.
the girls on it.
Okay.
I really, yep, I definitely do. Especially since they're two little purebred labs.
Okay.
So, and Miss Griffiths actually has 2 labs. And so, do you want to say anything about it?
I was just gonna say, I would start it sooner than later. You can start seeing problems in your labs early. 2, 3 years old, you'll start to notice things in the labs. But yeah, I wish I've had this product a long time ago. Both my labs are on it. They're older now, but I have had rescues in the past that have been young and have had problems. And I wish that we had this, because the alternative is not tasty for the dog. And it was a
Yeah,
struggle.
right.
And so for this, it's been amazing. I wish it was here so that I could have prevented the struggles that my guys had gone through. So yeah, absolutely.
Yeah, and a lot of times when it comes to especially like hip dysplasia and stuff like that, you don't know about it until you have a problem and they get x-rayed. We have our puppy, he's not a puppy anymore, he's a year and a half old, our golden retriever. And we had him in to have him x-rayed because he ended up growing so fast that he had a bone infection or inflammation, and also has severe hip dysplasia as well. So I'm very grateful that we have him on this, because it's gonna be a rough and short life for him, probably, but we gotta do what we can. So, but had he not had that inflammation in his bones, we would have never known about hip dysplasia at all. We just happened to have him in the x-ray for that, did the full x-rays. So, yeah. And you know, Miss Dawn, who's on here, she actually has one of Rudy's, sisters, which is, I think it's one of the sisters, isn't it? Or is it one of, I'm trying to think it was one of Lacey's. Anyway, she's one of my puppies.
Yeah.
And Dawn, all of the parents tested fine. You know, we tested some of the other puppies for x-rays and everybody was fine. So don't worry, this is the first time you're hearing about this. So they all tested fine. It just is, Rudy is a massive 120-pound dog. He's just massive. So, but so what is another thing that you guys hear a lot that your clients this time of year are saying? Like, they're just like, you know, this is an issue. What can I do about it?
So I would love to hear about
diarrhea. I love
Oh, wait, who? I hear diarrhea. Is that what?
We heard a lot of that at the expo.
Okay, a lot of diarrhea. So as you know, food. Oh, it's breaking out.
When we did the dog expo, we had a lot of,
Okay, so obviously I always check the food. I always want to know if the food has any dyes in it. Dyes is one of the leading causes that I've seen. So the best way to talk about, oh, does it look good, or is it one color? If it's one color food, and you know, Miss, Rock, you know about that. So diarrhea, I always worry about, since the intestines are probably inflamed, so they're also not absorbing their nutrients. So the multivitamin is something that I would go with, and of course the digestive support. Those are the 2 main things that I would go with. I would also want to know when the last time they had a stool sample checked was from their veterinarian. You do not see worms in the fecals at all. You'd be shocked. A lot of people think that, oh, well, my dog's fine, there's no worms in the stool. We find them under the microscope. If that is negative and they're still having issues, I always worry. I would go a step further. There's something called giardia, which is on the rise as well. It's It's not a bacteria, it's a protozoa, whatever that is, and that is often seen too. You can't find it under a microscope, so that's another thing. No matter what though, no matter what the cause is that I give them the digestive support, the multivitamin, advise them to the food, no dyes in the food. That's a huge one. And that usually eliminates most of those grocery store brands. I also, if it's an acute case, I do recommend a bland diet for about 2 to 3 days. So bland diet is going to be something that gives those intestines the white rice, plain white rice, broiled or boiled chicken without the skin, plain, everything plain. Eggs, scrambled eggs, no seasonings, no, just with milk. Mixing that up and doing that for, I would say, at least the next 2 days. If it forms up, they can slowly, when I say slowly, I would say just a couple kibble at a time, start adding that into the diet slowly and see if that helps form it up. Because the goal of a bland diet is to give the intestines a break. So does that help a little bit? If that, and some can get, dogs get viruses and stuff like that too, and there's, but that usually tells me too that if it's not getting better, they need to go to their vet and definitely take a stool sample as well. So I hope that helps. And obviously the wet away too, because diarrhea in the house is not fun as well. So that's where I would go with that. Do you guys have any other advice on that one? Okay. And that goes as far as the diets for the treats too, because a lot of times you guys know those treats they're full. They're full. If it looks good to us, it's not good.
So I have one more. We can add pumpkin too. Pumpkin is a good helper for diarrhea.
Real pumpkin.
Yes. Real pumpkin puree.
Yes, but pumpkin has a lot of fiber, and that doesn't give the intestines a break either. So you have to be, so if you're going to try that, I would try it with, so if they're loose, just loose, kind of loose and not formed, I would go pumpkin. But then my advice is just to wait, because yes, it's fibery, but it can also, if it's to the point where you're seeing diarrhea, a lot of it, those intestines need to break first. But yeah, they could try that too, or even try pumpkin right away to begin with, and then go straight to the other diet. Now, if it gets to the point where you're starting to see the pets you're seeing vomiting and diarrhea, they need to go to the vet, because then you start worrying about dehydration. And even a lot of people and a dog with diarrhea needs to have access to water at all times as well. So that's a big thing. Good. Anything? What's another one? Okay, so I should probably just talk about this. So I am going to talk about why I love the digestive support for those. So the reason we recommend, the multivitamin, it's multivitamin. Everybody, it's all the goodies in it. Especially like we were mentioning, the dogs with diarrhea they're not absorbing their nutrients because things are just shooting out of them, right? It's just shooting out of them. So that's the purpose of that formed stool, is so that way the body can break it up and get the nutrients that it needs as it's passing through the system, where diarrhea just shoots out, right? So that's why we need this multivitamin. Has lots of goodies in it. Oh my gosh, that's good. Now the digestive support. So the purpose of the digestive support, it helps a lot of different things. It's kind of a hidden. This is like gold, really. So you guys have probably heard the expression, a healthy gut means healthy gut means a healthy pump or healthy you. So you got to get what happens in the body at the gut level, because us and our dogs are constantly putting these processed foods, and I'm guilty, guys. When I say this, I'm saying this because I know for myself. I mean, I just get top highs for Pete's sakes. It's the worst thing ever. So, but those processed foods are not giving, and they're not healthy, and they're not what our digestive system was meant to be digesting. We do not have the proper enzymes that are needed to properly digest that stuff. Same with the dogs. The dogs and cats do not have, they were meant to be, just like us. And forgive me, I'm going to say God here, but, and even if you don't believe in God, it's okay. But we were given everything that we need to survive on the land. We should be living off the land. and so should our pets. So what that we have noticed is that's causing is we have all these bacteria, and we have what else am I thinking? Different, like good bacteria and bad bacteria, and they need to work together. But what's happening is the bad bacteria is winning. Okay, and it's being fed, and so that's why you start to see these digestive upsets. What we're also noticing is that also when that happens, we start to see the immune system crash, right? Because your body's constantly fighting something down here at the gut level, it's going to start crashing. And so more and more things, like you hear pets with allergies, right? So that's a big one. Ear infections. This is why when you guys see me posting about ear infections and my Goldens or ear production and wax, I don't have to clean my Golden's ears anymore. Golden Retrievers are notorious for ear infection. And I was cleaning them every day. It was bad. It was really good. And I feed them a pretty decent amount of things. But their guts still needed some help. So by helping the yeast and bacteria at the gut level, right, get that healthy, get that all balanced out, we now then are boosting the immune system. So the body can properly fight, and it helps to control the yeast, the bacteria on the skin as well. Also, if you get that all under control, a lot of times what you're seeing is dogs that have food allergies, which a lot of times are more like intolerances, not necessarily food allergies per se, but what we're seeing is that by getting it under control, the skin and the system doesn't want to fight against itself. So we can get that redness, the yeast, overgrowth, the hot spots, that kind of stuff under control. So we're seeing a huge difference. And also a lot of times when you think of intolerances or food allergies, it's because what's happening at the gut level. And because the dogs don't have the proper gut flora to be digesting what they're supposed to be digesting. Does that help kind of? Makes sense? So that's why this is so important. So when you have a pet that has like a skin issue, is licking. Another thing too, which people don't realize is you'll hear pets that are licking or biting at their paws, and you'll see where it's all kind of like this. A lot of times it's transferred from the ears. They've been doing this to their ears. And so now they're licking the paws to clean them. So now you have that yeast and the bacteria overgrowth in the paws. And their back feet, they're doing that with their back feet because they itch. So this is why this stuff is so important. So this probably is one of my favorite products, just because the testimonials I see out there they really are life changing for these pets. Because I don't know if you've ever had a dog itching or scratching at night next to you in bed. It is the most annoying thing in the whole world. And it is. So any questions about those two at all? Oh, and this is a 90 chewies in this for $35. So if you have one of the smaller breeds, it's going to last about 3 months. I always, if you have a dog that is actively, especially with an ear infection, has active infections going on or skin issues going on, I recommend starting. I do it the first 1 to 2 weeks on a double dose, just to get things kicking, and then reduce to a lower dose. Is what I've been finding is working. So it is something.
Go ahead.
Oh no, that's okay. Go on.
I was just gonna say, and at the time of year that the dog has their allergies. So some dogs have more allergies in the spring and some have more in the fall. So it's important that you kind of pay attention to that as an owner, so that when you're doing dosing, like for Tigger, for example, my complete allergy ball, I boost him up as soon as like the snow is gone, because he's allergic to grass, he's allergic to trees. So as soon as those pollens start coming out, it's like a major attack on his system. So I boosted him up, and I boosted him up for about 2 weeks, and now he's back down. And he's staying pretty good. But if I started to notice that he's itching or licking again, I would bump him back up. So it's kind of a playing game a little bit when their season, if you will, is in play. Because the recommended dose is to keep their gut happy, right? And so as long as we keep that gut happy, everything else will fall in line. But that means in normal situations. So if they're having an allergy flare up, their immune system is boosting up. So we need to help their system and boost that up as well. So it's kind of, it all works in tandem. I hope that makes sense.
Yep, yep. And you brought that up completely too. So okay, so what
I was just gonna
another
say-
question is, I'm sorry, what?
I was just gonna say that I always bring it up that it's a prebiotic and a probiotic.
Mhm.
And the way that I relate to people is I say, just like the human gut, problems stem from it. And in a dog, they go outward, they go to the ears, they go to the skin, they go to the paws. It's just like trying to get away from that unhealthy gut, and it goes to the exterior. And people really can relate to that when you say it's kind of like the human gut, that most problems start there. So,
No,
but I think it's important to always say it's a prebiotic and a probiotic.
Yeah, yes, you're so correct. I'm glad you mentioned that, because a lot of our competition, so when people are shopping around for other products like this, usually what you find is one is just a probiotic and one is just a prebiotic. And we have it combined. It's not a powder form, it's a yummy little treat. So that's why we also beat out the competitors. And even price wise, if you look at the fact that ours is the 90 chewies, it is a big savings. It really is. And another thing that Ms. Griffith said too is, as a pet consultant, you're going to get people that are asking you about allergies. And like you mentioned, April, is you have environmental allergies and you have your food allergies or intolerances. So it's going to be, as you're learning this, get a hold of me, get a hold of one of us, and we can help you determine, because the process of elimination as well. So, because, sometimes certain things that we have might not help, like I said, certain things. So as long as we're talking about allergies, we also have, I don't have it with me, forgive me. I actually sold my last one. But when you start talking about hot spots or those skin disorders, there's other products we have as well, because as we know, as humans, we want to see results immediately. Also, bacteria, when you hear a hot spot, there's two kinds of things, and I've kind of heard. A true hot spot is when it has the little yellow crusting on it. That's the bacteria. Okay. So for that, we have the tea tree. We still want to do the digestive support, but we have that tea tree, the anti-itch spray, which is wonderful, because with a hot spot, you actually want to keep it dry. A lot of people think that they should be putting ointments on it, or they want to wash it, and that makes it spread, and that bacteria spreads fast, very fast. So you want to keep it dry. So if somebody says, hey, my dog gets hot spot, what I do is I say, okay, you want to shave the area around it. Their dog's gonna look goofy, but that's okay. I have them shave the area around it. Just if they have an electric razor, if they, I don't want them with a razor, but we're cutting the hair around it, because we want it to remain dry. We want that breeding ground to go away. And so then what I do is, there's a couple things we can do. The no rinse shampoo has lavender oil in it, which acts as an anti-inflammatory. And we also have the anti-itch, which has tea tree oil in it, which sprays it. So here's the kicker though. If it's a spot where the pet is licking, you got to be careful, because the tea tree oil isn't something that we want, and the anti-itch isn't something we necessarily want the dog to be licking at frequently. So what I would do in that case is I would go with the no rinse. It's a nice little foam. It's all over my hands. It lasts forever. It's the foam. It's all. I love this smell. Sorry, it's such a dork. But it has the lavender, and it is a good quality lavender oil in it too. So that's what I would recommend, because this is going to naturally dry as well. So that or the anti-itch spray also works. I have had now, once those crusties are gone and the area doesn't have that bacteria in it anymore, then you can go ahead, and then I'd recommend putting the paw balm on it. Paw balm on it. I am such and it is human grade, so I put this on my list. But and this is another thing too that you guys can use, and I don't know if you know this, but you can use this in your hair as well. The no rinse laws, I'm talking about it too, is something that you can use. I do want for on your dogs, and just Miss Griffiths has an amazing we'll have to have you share it. An amazing step 1, step 2, step 3 with the donuts. But but the key is once, if the yellow is still there on the skin, you want to keep it dry. Okay. Once the yellow is gone, then we can start doing like the paw bomb and talking about stuff like that. So that's a key thing that that I think, because otherwise we can make it worse. But again, call me, get a hold of me. I will help you. You can patch me in on a conversation. We can walk right through it. So, and you will learn all this as we go. So I don't want you guys to think, again, don't get overwhelmed, because your job is just to share, and then bring me in and I'll help you too. So I know I'm just, it's crucial to me that you guys get the correct information. So, okay, what else do you hear? What, Miss Griffith, you hear lots of things. What do you hear?
I think a common one that I get is, can my diabetic dog take these?
Yes.
So that's
Yes,
like something
yes.
that I get a lot.
Yep. I would give them, if they're insulin dependent, they're gonna want to give them with the meals before. So usually what happens is they get the meal, they get the insulin shot. So I would give the treats at the same time as the meal. Also in humans, spirulina, which is in the dental tubes, has been shown to reduce blood glucose levels in humans. And since humans and dogs are pretty similar in that kind of situation, I would also recommend the dental tubes as well. It has huge benefits for diabetic patients. So yeah, that's yep, everything's safe. If they're ever concerned, have them talk to their vet. That's something that I always, and I have no problem if anybody ever wants, a veterinarian ever wants to talk to somebody, I have no problem talking to them as well. So you guys can, let's see. Let's go with, since it's looking stormy out, how about those anxiety issues? I bet you heard a lot about that this past weekend. Yes, the calming support. So the key ingredient in that calming support is L-tryptophan, that same ingredient that on Thanksgiving, after you've eaten half of a turkey by yourself, you're just kind of, oh, I feel good. Yeah, I feel good. Here in Wisconsin, they're watching football usually, so for the next few hours. But yeah, so calming support. I think of calming support anytime I think of any sort of nervousness. I think shelter pets could benefit from it. I think dogs coming into, any dog can benefit from it. I have a friend that actually, she gives it before she takes her dog for a walk, because otherwise when she goes to take her dog for a walk, the dog's like, and I actually saw them walking. I think it was yesterday. They're in New Lisbon, Miss Griffiths. But and I saw them walking, so I was so happy to actually see that happen, because otherwise the dog would never go for a walk. One thing though, I always wanted to say too, is that calming support cannot replace good training, right? And Debbie, you know right now, because of those puppies, good training is crucial.
Have been a lifesaver.
They do. Right, I agree. And what's cool about it is while you're training, it's also teaching I don't know, maybe somebody knows how this works. You probably do, Miss Griffiths, or your husband can tell us more about it. But it is actually, the way it works on the brain is it's training the brain to remain calm in those situations. So that's how dogs learn to do things and not do things. Like, okay, well, I felt anxious during this situation, so I must always have to feel anxious during like a thunderstorm during this situation. Or, does that make sense? So, well, I was nice and calm during that situation. I was getting pet with my mom, which means the next time I hear that noise, I should remain calm. Just little weird things like that. They don't have that logic that we do. They just know how they feel in certain moments of time. So, so calming support is huge for that. My favorite, and what sold me on Avetica, because for those of you, April and I don't know, but I was watching, I was stuck in this business for about 2.5 years. But I could never just bring myself to sign up, because I wanted to see what the products did, and we hadn't launched the products yet. So what I did is I signed up, I was for $5. I signed up with a $5 deal and bought my calming support. Within that next week, after I tried it, I had literally bought almost every product. So yeah, I was sold. But what changed it for me, I have Nellie, she is a breeder, an old breeding dog. that lived, she lived her life on her first 3 years with her sister in a little Amish 6x6 kennel. They came out to breed. That was it. I guess it was Kate. I mean, the poop was like this thick, was my understanding. But then from there, her and her sister went to another breeding kennel, which this is so hard to say. It was a clean facility. It was a clean facility. They had rungs. They had, you know what I mean? They got to go outside and play. It was still just a professional breeding facility. That's what she was used for. So long story short, she had never heard speak. She had no idea what a broom was. Sure, I mean, it was just shell shocked. So what was happening is when the first storm came, which just breaks my heart thinking that just all those years that she's like sitting in that kennel just petrified of these thunderstorms. She would literally, I'm so visual, I'm already looking to see. She would go to a corner and she would scratch the floor, so like every corner in the house, and just raw. I mean, it'd be bleeding, just blood. The only thing that could calm her down, and I tried everything, prescriptions, a thunder shirt, I tried a lot. And even natural stuff. And I would have to just lay next to her and on her and apply that pressure to her, and she would just shake the whole night. She would just shake. It was so sad. Anyways, 2 of these shoes, and 25 minutes later, she was laying next to me in the middle of a thunderstorm. This is life-changing. Seriously life-changing. Now, like I said, I don't ever, good training is huge. If you have somebody who is talking about a dog that's biting, you know, those kind of situations, yeah, try it. But that's not a quick fix. There's just certain situations that are pretty serious. And if that's the case, we'll send them over to Dove's Dog Academy with Miss Trasper and Willie, because they need some training. But yeah, it is definitely something to help. It's wonderful with groomers. I do know in the grooming situation and at the veterinary clinic that they are getting great results from normal dogs that in those kinds of situations are more aggressive or just, you know, usually fear. Aggression is usually a fear-based issue. So the calming support helps as well. And what's also nice about it is something that you can continue to give. If you don't see, if it's not okay on chew, then you know what? In 20 minutes, give another chew. So Ms. Griffiths, I would love to hear you talk about Tigger, because I know it's been, the first time I saw him, and then the next time I saw him, completely different dogs. And I think it was only like a 2 or 3 week time frame.
Yep, he is a completely different dog, totally a different dog, and he still is changing, I think. So I did a lot of conditional training with him with calming, because he is terrified of linoleum, and my like entire house, like everything but the living room and the bedrooms in our den is linoleum, and it's not like short. We're in a ranch, so you got a long
It's
run.
a big house, guys. It's a big house.
You got a long run past the bedrooms on linoleum. Then you get to the kitchen, which is linoleum, and then there's a run between the den and the living room, which is all linoleum. And he was a rescue. I had no idea of the situation he was in, other than he was kept in a small location in the garage and never allowed really in anywhere. And when he would sneak into the house, he would get reprimanded physically. And the first room in that house was linoleum. So that's like the only thing that I can think of on why he's terrified of linoleum. So we brought him home that day, and he's a big dog. He's not a little dog. He's a big chocolate. And we went to come in the house. Yeah, he did not come in the house. We finally eventually convinced him to come into the house onto a little foot mat type thing, you know, the 2x3. And he literally sat pressed up against the door on that. I tried everything to get him down. So then we're in a ranch with an exposed basement. So we're like, okay, we're going to go ahead and try and bring him in the basement, because that's at least all carpet. Yeah, well, that's when we discovered he's afraid of stairs. So that didn't work either. So the next day we ended up lining all of our linoleum with runner rugs to get him through the house. And that's pretty much how we were until Novetica. And then Heather came over and gave him calming, and he laid down in the kitchen. Like, that didn't happen ever. Like, Like I was trying to explain to her how he would duck into the kitchen, he'd duck back out, he'd run around, and he'd duck in and he'd run around. So that he was still kind of standing on rug.
I thought it was just because he loved me. That's why. It wasn't. It was the calming.
It was the calming. It was amazing. And so we just continued to work with him. And I'd say, I don't know, maybe a month-ish, I started to take away rugs. And now we're rug free. And we could be completely rug free. Just there's a rug at the back door. Because I live in the country and people need to wipe their feet before they walk in the rest of my house. But pretty much he runs everywhere. He runs up and down the stairs. You would not know he was allergic to linoleum and the floor. The other thing that we use calming for here is airplanes. So we live by the Air Force Base, fairly close, and we are within landing pattern. And it's like literally a mile, 2 miles, maybe max away. And they fly over. And he doesn't like that at all. So he's afraid of jets and thunderstorms as well. And we are continuing to work on that. He's getting a little bit better with jets. The problem is they're not predictable enough for me to be able to train him and give him calming fast enough to help. So we actually use this last section of night ops to do some training because we get warnings when they're going to be flying at night so that we know that that's normal activity over the house. So I was able to use like the last 2 weeks and help start training him because they were flying over pretty routinely over and over and over again. So then I could start to train him, but it's still like today, I think 2 flew over. So it's random. It's so random that it's hard to train him on right now. But yeah, calming has been amazing. I will talk about, Heather talked a little bit about dogs that are biting. I have been helping a couple of couples as well with aggressive dogs in training conditionally there too. And I've actually used calming slightly different. So they get 2 calming in the morning, they get 2 calming at night. If that's enough for their dog, then that's all they need. But in the beginning, most of them end up with like a midday calming as well. And what we've been doing is what that does is it keeps their brain at chill all the time. So they don't end up jumping into that aggression mode. And it's been working. It's been working phenomenally. I have a client right now who has never been able to have anybody in her house, like to the point where they have a guillotine door to let the dog out and put it down. She can interact with the dog, her husband can interact with the dog, but nobody else. And so we have been working together and they've had people at the house. They've had many get-togethers now. They were able to go on vacation and have a dog sitter. So awesome stuff is happening for this dog and it just keeps happening. And so a lot of that has been done through conditional training and helping that dog to understand that it doesn't need to be at high alert. So I have a couple of dogs that I've been doing that with now, but the calming has aided in the ability to train the dog because it relaxes their brain enough so you can actually work with them.
Yep, perfect. The other tool we have too is the CBD oil. That in humans, one of the things that we have to keep in mind when we are talking about our CBD oil with pets is that we have to be very careful. And this is, yes, it's silly, but the Federal Trade Commission has strict regulations on what we can and can't do with CBD oil. Also, I know, I believe, I could be wrong, but Nebraska is one that can't really, that isn't, I don't know if you guys are able to sell it. So be aware of what your state, you can. Okay, so then I think we're okay. I think Nebraska might have been the only one that I saw. So there's a couple things when people are going to ask you about the CBD oil, like, oh, I don't want my pet to get high. And I should probably have Miss Griffiths' husband come on and talk about this a little bit different because it is, CBD, and the hemp plant is different. The cannabis is a different plant than what we think of as the marijuana or to get high. So don't, just laugh at them and say, oh, if only, that could really happen. But so what we can talk about with CBD is what we've seen, because there's a lot of studies that have been done on the human side, right? So what we can see is, well, in humans, we know it helps, them relax. It helps with cancer patients towards end of life. It's great for If you have patients that are in pain, or have, I should say show discomforts, that's another thing. So there's certain things there that we can really, sorry, my son's trying to talk to her with it. And so we got to be careful what we say with it. So basically when you're talking about CBD, I say, hey, you know what? Especially cats, this is one that's good for cats. I do have an elderly cat. This is wonderful. This is my go-to for any elderly cat. Or any elderly patient that, you know, just can't get results from other things. I think CBD brings them great comfort overall. I'm trying to think what else. Anything else? I know, Ms. Griffiths, you guys did a lot of research on it as well. Is there anything that you can think of?
Sorry, I had to get my mouse in the right place so that I unmute. Yeah, so we are seeing a lot of things that, like, in the human world. So anxiety, it helps with. There's some evidence that seizures it can help with. It is helping in the human world for that. Arthritis, appetites, those types of things. I know that I just started a couple of clients on CBD, one for cancer, for help to kind of just help the dog in its last days, really. And she was just really looking for pain relief. She doesn't want anything other than pain relief. I did convince her to try multivitamin to see if we can do anything. They are surface cancers, so they're not like in an organ or anything. They are surface cancers. So and I'm not 100% sure why she didn't want surgery or anything like that, but CBD was what was her comfort zone. And then I have cats. Cats seem to be the place where I have been able to promote CBD oil more so than in the dogs, because we don't have anything else that we can help our cats with, right? So when we cross into those realms, we can now help them, because, right, if they have arthritis in their dog, we would do hip and joint in most situations. If they're anxiety, we would try calming first for a dog. But in the cat world, we don't have that stuff. So that's kind of where I've been utilizing it a lot. There has been a little bit of evidence that it can help with allergies. So that's another one. I don't have a whole lot on like types of allergies, just that they're saying that it does promote relief for allergies. What is the other ones I got here?
I was thinking also too is for also for cats that have that spastic, that irritable bladder. So with cats, it's kind of a with cats, again, this is where you always want to just kind of play, because a lot of people are like, oh, my cat's doing this or peeing all over the place, it's doing this. The first thing I want to ask is, have you had a urinary tract infection, a UTI ruled out by your veterinarian? That has to be asked before. Yes, what we're going to do is going to help the cat, but it has to be ruled out, because so many cats end up in the shelters, first of all, because people think that, oh, my cat just feeds me. He pees on the bed all the time when I leave. And no, probably not. You know, probably has a urinary tract infection, and probably, you know, a lot of times cats develop the crystals in the urine because of that. It's just a spoopy cycle. But what CBD oil can help with is somehow when cats get stressed out, you know, like when we get stressed out, our neck and our shoulders get tight, you know, we feel those physical results as well. Cats' bladders go out of control. It's the craziest thing. So whether it's you move the furniture around, whether it's, you know, there's a new cat outside, something, cats stress out so easily. And so a lot of times their bladders get all angry or whatever. So one, if a cat is urinating outside or urinating or pooping too outside a litter box can be a sign that a cat has a urinary tract infection as well. It's crazy. Cats be like, oh, it hurts to pee, so they get out of the litter box so quick, and they haven't finished going to the bath, you know, they haven't pooped. So then they hold it, and they just can't hold it anymore. Then they go somewhere else. So that's usually the way. Remember how I said how animals, or I said dogs, but animals relate to, okay, I'm in this litter box, and every time I'm in here, I'm in pain. So then they think, okay, this litter box is causing me the pain. So they're going to hold that bladder, hold it, and also they just can't hold it anymore. It's going to be on your bed, or it's going to be in the over there in the corner. So CBD oil, again, one, gotta rule out that UTI. I never talk behavioral issues with a client ever when it comes to any sort of urination issues, unless a UTI has been ruled out. That's the number one thing they need to do. They need to go to their veterinarian. And it has to be, I know this is getting into more detail, but it has to be a complete urinalysis where I want the veterinarian to actually look with a microscope and that's normal. That should be what every veterinarian is doing, but some don't. So I want a complete urinalysis. And then we'll talk about, yes, let's go ahead. You know, CBD oil is going to help calm, right? It also can calm the bladder. So that is one of the big things as well. It also can increase thirst and appetite as well. That's where I kind of joke around. An easy way to remember that is when you think of the stereotype of when somebody's stoned, right? They're going to want to eat more. So, but it's also going to help with just the pain in general. So yeah, CBD for cats is kind of my all-around go-to because it's amazing. Like I mentioned before, I think there's so many things on this earth that we should be utilizing. And this is one of them. This really is one of them. And it is safe for pets. So if you ever have any questions further, or people really ask me a lot more questions about it, get a hold of me and I'll walk you through it. So anything else you guys can think of? Dawn, is there anything that is burning that you really want to know? Oh, Dawn,
Dawn
how about Debbie? We're doing good? We're doing good. Okay.
So Heather,
so I think
one other thing CBD does is it boosts the serotonin in them. So that is their mood. That is their mood. So like if I was not seeing the success I'm seeing out of my aggressive dogs right now, my next step would be recommend CBD oil. But calming is doing it. So that's why we're sticking with calming.
And you can do them at the same time too, which is pretty cool. So the serotonin, so a lot of times when you guys think of like in the human world, like I have my anti-anxiety medicine is because the way it works with me is I don't have enough it's kind of tricky the way it works. It's not that you don't have enough serotonin, it's just you might not have enough little openings. It's weird. But my brain's not getting enough serotonin. And so that's when my anxiety kicks in. So I am on medication to help my brain get enough serotonin. So that's that's why it works so well. And that's why everybody in the United States needs to be on an anti-anxiety medicine. I'm just kidding. Or CBD oil. And yes, this is human grade. It does not taste great, but it also has salmon oil in it as well, which, like Ms. Curtis was saying, probably is also part of the reason it helps with allergies or kitties with dry coats. That's another one. I hear cats with dandruff. This is another one for kitties as well. So yeah, I agree. I know something. I think we're doing pretty good. We just mentioned about the skin and coat for dogs. So we do have the skin and coat for cats. I'm sorry, the CBD salmon oil. We do have a skin and coat for dogs, which has all those essential fatty acids in it. A lot of dog foods they're doing good, but they could be doing better. So what's the difference between the digestive support? We talked about skin issues, right? So this I think about when this is helping to treat the problem. Does that make sense? So it's helping to treat the problem, where this is helping the skin to heal, or it is putting it in condition to be able to heal. Does that make sense a little bit better? So, in order for the skin to heal, it has to have certain ingredients. And if it doesn't have those essential fatty acids in it, it can't, start to regrow the hair. And so that is why a lot of times you're going to see both of these used together. So if there's a pet that's simply just having dry skin and just the coat's just kind of lackluster, it's not, I would go with this one. But anytime, that's what the skin and coat is for, is to help the skin and coat look better. So think of it that way, is to help it look better, even if that means hair growth. It's also wonderful for excess shedding. I have some clients that were on it over the spring. I mean, their pets, not them. Their dogs were on it over the spring, and it really helped. One was he's a Great Pyrenees. Oh my gosh, it's huge, and it dramatically helps the hair. And so what it does, it's not that it's going to prevent the hair from shedding, because it's still going to shed. It's not going to help, but it's be a little less, but what it's gonna do, it's gonna help the hair, because it's gonna be healthy hair at the follicle side, it's gonna have it stick together. So you can control it a little bit more while you're doing the brushing. Does that make more sense? So we're not preventing the shedding, we're just helping it shed better, for better control. So that's kind of that. Can you see anything else for that?
Yep. So I like to explain it as like our skin and coat is making the hair healthy, and it's also making the follicle healthy. So what happens then is their hair doesn't fall out, one, as easy, but it also doesn't break as easy. Some of our overshedding comes from breakage, not just like coming out. Like when their coat is not healthy, their hair will break more, just like us. You know, we got split ends and we got hair hanging out all over the place, right? The healthier it is, the more it's going to stick to your head, the less you're going to lose. Same thing with a dog. If it's healthy, it's going to stay there and it's not going to break, just like us. So that's kind of how I like to explain it, so that people can kind of understand the difference, I guess, between what their healthy fur should really be doing versus what it's probably doing right now.
That helps. That's a great, I hadn't looked at it that way. That's awesome. Thank you. Yes, thank you. So I think the last thing is I really want to, and then I'll just let you guys go, is I hope this is helping, Debbie. Are you feeling a little more confident? Okay. So the last thing that I love talking dental, I think it's because I've done so many dentals in my life, like sedated, where I'm in there and cracking tartar off the teeth and scaling and polishing, and it's nasty. Guys, it is one of the nastiest things, but I love it. I love it. I love it. So, and yes, the dogs are anesthetized, so they're not awake when I do this. But so something to think about. So now, like Debbie, in this Griffith, with your bigger dogs, right? So you probably are not going to see the problems necessarily like the smaller dogs are doing. And that's because the bacteria, kind of like I was saying earlier, that bacteria on the skin likes these wet, cramped places. So that's why I want to get the hair off and keep the place dry. So bacteria loves them out. And of course, we know I've told hundreds of people that they need to be brushing their dog's teeth, and I think I've done it twice to my own dogs. I'm gonna be honest, I don't brush my dog's teeth. I have 9 dogs, so it's really bad. Okay, maybe 3 times. I may have done 3 times. But anyway, so that's why I love these products. Ours, yes, are better than the competitors. Ours are true nutraceuticals, meaning there's good stuff in them. They are my favorite, and I've said this a few times, there's a superfood called spirulina in it. This is the one I was mentioning that is great for diabetic patients, because in humans it's been shown to help reduce the blood sugar. There's 2 different kinds. So just to do the confusion, Debbie, there's the small chews, and then there's the large dental chews. So the larger ones are not large enough for our dogs. I mean, really, your puppies would eat this in one, they'd swallow this, right? And it doesn't have quite as many ingredients. So, and Miss Griffiths can help me with this. I mean, so technically you could give them 2. So these act as a toothbrush. Okay, so these are formulated different than these, even though it's going to say large dog, small dog on them, they are different. I actually, with small dogs, recommend both. Okay, because this is the toothbrush, right? And then, well, I'll just open this one. I'll open this one. I'll use them. And then these are the goodies. This is what is doing the work. My cats love them, which is good because these are safe for cats as well. Just the little ones, the big ones, you don't want to. Maybe a cat would feed them. I mean, it would be safe, but these smaller ones have more of the good stuff in it. So, oh really, Bobby? My beagle's yelling at me, probably because I just opened some treats. So the way, and plus we have the dental adder too. So this is like your mouthwash, you just add it to the water. So what I think about with dental, Bobby, you're just fine. The big fat old beagle. I love him. And so he's CBD oil. He is a great testimonial for the CBD oil. as well. So I got to give it to him too. I've been slacking on that. But so with the dental system, just like you and I, if we don't brush our teeth for 10 years, it's going to look nasty. It's going to look nasty. It's going to be caked on. And what's happening is because the mouth has so much bacteria in it and we're not washing it out with the dogs, it gets multiplies, and then the bacteria has waste, which you got plaque, then you get tartar, and it just keeps building up. So think about it. Do you know somebody, you probably heard how somebody a human has to go to the dentist and they have to take, especially if they have any heart issues, they have to take antibiotics like a week before they have any dental. Okay, so this is exactly, you know exactly what I'm talking about. This is why, because there's so much, think about this with pets too, there's so much bacteria, and when it gets in the gum, you know how it's easy for your gums to bleed. It's so, gums bleed so easily. It's a direct line for that bacteria. It's almost like an open wound. That bacteria can work its way into the bloodstream, goes to your heart, can go to your kidneys, can go to the liver. That is why they have you on an antibiotic to protect you from it. It's the same exact thing for dogs. So that's why it's so important, especially those small breeds. And that's why those small breeds, I mean, dachshunds, for example, every dachshund I've ever known, they actually develop holes in their gum line, like holes, because of such horrible, that small, narrow mouth. The bacteria just takes control and ruins their mouth. So it's really important that we take care of their teeth. So what I do, so this is once to twice a day, fresh breath. Even if a pet has fresh breath, let's say it's a large dog, you can give it to a large dog. What I do is I break it up into their food. I've also heard, Miss Griffiths, are you the one that gives it at bedtime? A good time to give it is at bedtime, because then it's not getting, it sits in the mouth a little bit.
I have a question.
Yeah.
With those small ones, does it matter if they chew them or not? Because I have been giving them to the pups, but they like, and it's gone.
I have a trick.
Miss Griffiths, do you have any?
Yep, I have a trick.
Okay.
So I have two labs, obviously. Yeah, I know, I'm sorry. You're not getting any more, you've had enough. So I take their treat and I hold it like this, literally like this. Can you see how much is showing? Like not a lot. And I make them nibble it out of my hand. So they nibble, 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 nibble. Once they're finally in, then I let go, and it causes them to chew it, because now they've nibbled, 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 nibbled. And by the time it hits their mouth, they're going to at least chew it twice. Sometimes not more than twice, but they'll at least chew it twice.
Yeah.
And the other thing is, Heather, I call this one the toothpaste. So this is the one with all the good stuff. So the big one's the toothbrush, right? That's going to knock down the hard stuff. But this is the toothpaste. This is the one that's got all the good stuff in it. And then the water additive mouthwash. So that's kind of how I explain all three. Because I do put dogs on all three, all sizes, big, small, little, whatever. And Autumn's at like full attention now. So but yeah, so I put everybody on all three too. And that's kind of what I found. But yes, if somebody's trying to decide between, oh my gosh, I can only get one, I always lean toward the small, no matter what size the dog. And to answer your question, I don't know that it matters if they chew it, because that spirulina is going to stay in there, mixing around in the saliva and in their digestive saliva solutions, if you will.
Somehow
they recycle it.
And I don't know how, but it continues to work after it's eaten.
Yeah.
So yeah, it's pretty cool. And what's great too about this water additive too, and is that helps as a mouthwash to actually get in under the gum lines as well. So but again, I wouldn't, if you have a client that is bulky. Hold on, let me just toss him on. He's been begging this whole time. There you go. Oh, Daisy got it. There you go. Okay, let's go. Yeah. So I have no idea. Oh, and the where was the I didn't know I was saying. I'm so sorry. The it was nice about the water additive. That also you put what I tell people is a capful per gallon. Is that kind of what you've been telling people too, April?
I am using right now with my guys, I'm using 3 capfuls in a milk jug.
Okay.
So because I have 2 large dishes, so I just put it in a jug and then do it. So that's,
and it's not going to hurt.
Yeah, so that's
right,
probably pretty close. It's pretty close. I mean, it'd be 1.5 but yeah,
Okay, sounds good. So it is also, it has mint in it, which helps with dogs with upset tongues as well. And that is amazing. And mint, peppermint in itself is an anti-inflammatory. Now it is not something that if you have cats, I don't recommend putting it in the cat water if the cat drinks it. Because peppermint can be toxic to cats, and this isn't something that we can kind of monitor. We can't guarantee what the cat's going to get and what it's not going to get. So it's just something that I tell people. I mean, it's a tough one. It's a tough one. It's a tough one because I have cats, but I have 4 different water bowls around the house. So if they don't want to get to it, they won't get to it. They have that choice.
Sidecar should be her headset.
Yeah.
Good.
So sorry, my son's talking to me. Here you go, honey. You gotta come over here though. Oh, it's okay. So yeah, so I mean, ideally, I guess I would ask them not to if they have cats. What do you say, Ms. Griffiths?
I do not have any, I don't sell it to people that have cats drinking out of the same water. Just because they're
Yeah,
not
I
supposed
would
to have the
rather say safe.
peppermint. Yeah.
Yep. Yeah, and and like I said, what I do is I break them up for the cats, and my cats, they love them. They love them. And cats also, so a lot of times, cat people don't realize that cats do have dental issues quite a bit. So this is something that if it's a cat, I recommend it. So cats, it's crazy. A lot of them have this autoimmune problem where they actually, there's a kitty. Oh, sorry. Oh, I see you. Where is Mary? I have one. You see her? There she matches. You see that? She's black and white. She matches my background. But where was I going with this? It was so important. Oh, cats, if you look in their mouths, they have this autoimmune, a lot of them, where they are actually allergic to the plaque that's in their mouth. It's called stomatitis. And you'll see along the gum line a bright red line. And so take a peek. This is something that will help with that because it helps to control the bacteria that's in the mouth. So that's something a lot of cat owners don't know until all of a sudden, their cat's not eating. That's the first sign of a cat not or chewing on one side of its mouth. So a lot of people don't realize that cats can get dental issues quite a lot. Actually, I want to say by 8 years of age, it's already you're starting to see it's bad. So I a lot of cat dentals in my lifetime as well. So yeah, take a look at your kitty's teeth and see what you see. And have they tried the dental kits at all? Or have you, break them up and see if they like them. Okay, and I do, I just give like a little, little crumb. Even a little crumb is something. So not all 5 of mine like them, but some of them do. So that's good. So so I think, Debbie, where you are, would you find a benefit? So do you feel that you would be more likely to sit with a client on a pet consultant? Like you guys could do, like you're on the, like, for example, they're taking their, the pet assessment. Do you feel that right away, would it be more beneficial for you to have a paper where you can almost ask questions and go down that way? What do you feel that would make you?
Just what I've noticed so far, I think that the pet assessment, like if somebody wants to order something, they go to the website and that's like the first thing they see, or they see how to get into Novetica and, make money and all that type of stuff. I think that I wish you could change that because that I think turns it on. Yeah.
It is in the works. It is in the works. I agree. The website, another thing too that we have noticed is when it is time to check out. And I think this happened when you and I were first talking way back when too. Checking out process is so difficult for people as well. So it is in the works because I agree with you. I wish our website was geared more towards a pet parent versus making money. Yeah, 100% agree. 100% agree with you on that.
Yeah.
So it is in the works to change. We also have the new app that's coming out that I'm hoping, and that should be within a month now. I think we're down that will be just like the website, but different versions. So we can, it'll be so nice. We can just send it out to people and they can send it out to people. And so they'll be able to take the assessment from there as well. So, and they'll have some other features on it too. So that I'm hoping will help things out quite a bit for people too, but no, we understand. We understand.
Yeah. So what I do now,
I think I ask every week. Yeah.
Go ahead. I was just going to say, so
I'm done.
Okay. I was just gonna say, so what I do now is I really do not direct people to my website right now. And I try to do a lot of it via Zoom or phone call. And so what I do, so if they're taking a pet assessment, I will Zoom it, but I will have the pet assessment up already. So they're not going to my website. I'm in my website and we're answering the questions together. Or we'll do it on the phone and I'll do the same thing. And so that's kind of how I've been getting around the sending them to my website. But the other piece that I found is it helps me to be a better pet consultant because I know how they answered the questions. So I know what I can recommend versus sending them there and then asking them to tell me what it said. This way I'm able to interact right away, you know, and so that's kind of what I do. And I always make a joke about it. You get that video and I always make a joke about the fact that, oh, we covered that already. And I click it and we're right into the picture of what's recommended. And then Heather, you know, I always do, basically, I go through the products with them then at that point. And I really I stay on that screen for like a blip. It's literally, okay, this is it. And boom, we're now talking about hip and joint and we're moving forward on everything. And then we cycle back to the cart at the end because I don't want them to be thinking about the price while I'm talking. I want to build the value before they lock in, oh, this is going to cost me this every month. I want them to be listening to what I'm saying. And I feel like if they know the price, it's like, oh yeah, yeah, that one's not for me. And they start making excuses in their head and they're not even listening to what we're saying to them. That's just kind of personally what I have found. And it's been working for me. So, and like I said, I do have a shorter blip of Facebook questions that I put out there. But it's basically like the pet assessment. So I'm asking, how old are they? How much do they weigh? Do they itch, lick, scratch, or chew? Do they have smelly ears or Frito feet? Do they have rashes, red skin, bumps, or flaky skin? Does your dog shed all of the time? Do they have missing fur? Do they have dragon breath, tartar buildup, or do you know that they have a dental problem? And then do they suffer from any anxiety, car rides, thunderstorms, going to the vet, going to the groomer, fireworks, or any other situations? And then aggressive behavior. So those are the questions that I like focusing on. So I think I cover most of the pet assessment. I just don't have the, do they eat grass, stool, their activity levels, how much sun they get. Like I'm missing some of those questions, but I have like these questions direct me directly into whatever products we have. Does that make sense?
Mm-hmm. Yeah. And that's what I was wondering too, because I know, and that for me is sometimes easier, I guess, just starting to ask those questions. And like I said, I've kind of been trained to do it all this time. But for people who aren't quite sure, you know, because like you could be at the dog park or, you know, at the vet's office or something, you know what I mean? You just start talking to somebody who has a dog. And like for, you know, when you're new, it's like, wait, what does the pet assessment say? And then just, so maybe even having that as a study aid perhaps would help. I'm not sure. I don't know. And that's, I just let you know that I'm here to help you however you need me to help you. Okay, Debbie? So, anything else that you guys want to talk about while we're still here tonight? No? Okay, well, that was a good meeting. That was a good hour and 20 minutes. It was awesome. We did good. We did good. We needed, I do need to do more of these. It's just a matter of finding a time when everybody can get together. So, but yeah, this is great. So, and we have been trying to do, and again, this Sunday, I know I can't make the meeting. We have Little League meeting in, so I think the last 3 weeks, we haven't been able to make the meeting. So maybe these Tuesday nights might be the best night for everybody. I'm not sure, we'll see, but I hate to take away from the business opportunity meeting as well. So every Tuesday, Debbie, is a meeting. So if you have, and Saturdays, so if you have anybody that you know of that you think would be really good at this business or might be interested in this kind of business, we actually have a call like it's like this. And it's just set up every Tuesday night and every Saturday. where you can invite them to that. You don't have to do anything. You just invite them, and then the founders kind of take it over from there and explain the opportunity as well. So that's a lot of fun too. But otherwise, the other option too would be just to say, hey Heather, so and so, because I'd love to get Andrea up and having fun, because I think she would do really well with this business as well. And so it would be neat. Maybe we can because this Griffiths is kind of my right hand man. We live about a couple miles from each other, and our sons are friends, so we see each other all the time. But
Well, I know Andrea's like crazy busy at work, so
she is, and she doesn't get out till late either.
yeah.
So yeah, but maybe we'll do something here, where we can try to get her, because she could have a lot. I think she would have a lot of fun with this. I really think she would too. But okay, so on that, I guess I'll say goodnight. Does that sound good? Anything else you want to add? Okay.
Nope, I'm just about ready for bed.
All right, I know you were on longer than you wanted to, Debbie. So thank you so much, guys. I'll see you
Thank
later.
you.
Okay?
Yep. Bye.
Thank you.
Yep. Okay.
Bye-bye.
Yeah, bye.
Gotta go